Are you preparing for the OET speaking test? Today, we're diving into a home visit scenario for a patient with Alzheimer's disease. Learn how to communicate effectively, show empathy, and reassure the patient's caregiver. Stay tuned for practical tips and a sample role play. In this OET speaking role play, you are a nurse practitioner visiting Mrs. Linda Carlton, whose husband has Alzheimer's disease. She is feeling anxious about managing his condition and worried about her own health as she grows older. Begin with warm greetings and gently suggest a doctor's visit to review Mr. Carlton's health. Reassure Mrs. Carlton about medication management by explaining that the doctor will provide a clear prescription and a Webster pack, a simple system to organize medications. Inform her about available support services including social workers and healthcare assistants who can ease her caregiving burden. Address her concerns with empathy and mention Alzheimer's associations and family service centers, which offer vital support for both patients and caregivers. Your goal is to comfort her, provide helpful solutions, and ensure she feels supported in this challenging journey. Start the conversation with a warm and friendly greeting. "Good morning, Mrs. Carlton, how are you today?" Or, "It's lovely to see you. How have things been lately?" Establish rapport by acknowledging her struggles with caregiving. "I understand that taking care of your husband can be challenging, and I'm here to support you." This sets a reassuring tone, making Mrs. Carlton feel comfortable and understood as you guide her through solutions for managing her husband's condition. Begin by checking on Mr. Carlton's health with a gentle approach. "How has Mr. Carlton been lately? Have you noticed any changes in his condition?" This allows Mrs. Carlton to share any concerns she may have. Suggest a doctor's visit in a supportive manner. "Would you be open to scheduling a visit with the doctor to review his health?" Reassure her by asking about his routine checkups and offering assistance. "Would it help if I assisted in arranging an appointment for you?" This ensures she feels supported in managing her husband's care. Address Mrs. Carlton's concerns by gently asking, "Are you finding it difficult to manage his medications?" and offering support. "Would you like me to go through some strategies to make it easier?" Reassure her by explaining that the doctor will provide a clear prescription to simplify the process. Introduce the Webster pack, a system designed to organize medications. "Have you heard of a Webster pack before? Would you like me to show you how it works?" This ensures she feels more confident and in control of her husband's medication routine. Reassure Mrs. Carlton by informing her about available support services. "Are you aware of the support services available to help with Mr. Carlton's care?" Offer specific assistance by asking, "Would you be interested in speaking with a social worker for additional support, or do you think a healthcare assistant would be beneficial for daily tasks?" Encourage her to share her challenges. "Which areas of caregiving do you find most difficult?" And offer further guidance. "Would you like me to provide more details on the services available?" This ensures she feels supported and aware of the resources that can ease her burden. Offer emotional support by asking, "Do you have any support from friends or family?" and suggesting helpful options. "Would you be interested in joining a caregiver support group? Or have you looked into Alzheimer's associations or family service centers for additional guidance?" Encourage Mrs. Carlton to prioritize her own well-being by gently asking, "How are you managing your own health?" and offering assistance. "Would you like me to help you find resources to support you as a caregiver?" This reassures her that she is not alone and that help is available for both her and her husband. Wrap up the conversation by summarizing key support options. Would scheduling a doctor's visit help ease some of your concerns? Or would using a Webster pack make medication management more convenient for you? Offer additional help? Do you feel that a social worker or healthcare assistant would be beneficial? And would you like me to connect you with an Alzheimer's association or support group? End with a reassuring tone by asking, "Is there anything else I can do to support you today? And would you like me to check in with you again in a few days?" This ensures Mrs. Carlton feels heard, supported, and confident moving forward. That's a wrap on today's OET speaking role play.